room. Nice and cozy in here with plenty of old furniture. I'm waiting 1 minute for the music and then I'm starting the show. Alright, no music. Next week I'm bringing my 10-year-old who sings in the Metropolitan Opera. Alright, give him a minute to play it. Okay.
Friends, Dr. Mark will be here any second. I hope you don't mind, and be patient,
I'm
please.
here.
Seems to be a technical problem. Oh, there he is! Great to see you.
This is Dr. Mark Siegel. I'm an internist and an associate professor of medicine at the NYU School of Medicine, where I'm also a fellow in the Master Scholar Society. I'm a senior fellow at the Center for the Medicine Public Interest. I am also a columnist for the Los Angeles Times. I write a column every other week called The Unreal World, where I look at TV and movies for medical accuracy. And let me save you some time on that. They are never accurate. I also read a book called False Alarm, The Truth About the Epidemic of Fear, about how we're fearful of all the wrong things in the United States. And Bird Flu, everything you know, everything you need to know about the next pandemic. And Bellevue, which was a novel I wrote in the late 90s. And tonight, I have a guest host. I'm going to answer a couple of questions, but I got a guest host to turn it over to tonight, Nadir Paxima, who is also a master's in public health. In addition to being a doctor, he's the chief of orthopedics at Jamaica Hospital and the assistant chief of the hand service at NYU. So he'll answer anything to do with your hands, anything to do with your bones, your muscles, nothing to do with your feet. He may answer questions about football injuries if you're interested. Bellevue on the 3rd floor. That's the medical part, so I guess that's true. But we don't have much to say about the top floor, which is the psych unit, because we just try not to go there if we can avoid it. Syl, 2004, you're on the mic with Dr. Mark, and I'm warning you, you better have orthopedic questions. If you ask these medical questions to an orthopedist. Anyway, but I'll answer one just to get you warmed up in the room here. Syl, 2004, you're on with me.
Okay. Why me? Did I put a hand up? Sorry. Hello? Hello? Can you hear me? I didn't know that they have my hand up. Hello, Mr. Dr. Mark. How are you? Well, what is the subject? Oh my God! Yes, yes. I was listening to him, but I didn't know that I had my hand up. Sorry, but well, you were talking about injuries, football. You know, my question is about knees. Okay. How you what are the main injuries on knees that doesn't allow to many sport people in their career?
I'm going to turn that over to my guest host Nadir, and he's going to take it from here. You want to know what kind of knee injuries you see, especially in sports. So he'll give you the answer to that, and then he's going to move on to show Willie. And you can keep typing. Hands are not knees. No. Well, Holy Illusionist, try out Nadir and see what he says. Maybe he has a better answer than me. Anyway, here's going to take that question about knees.
Hi guys, this is Dr. Nadir Paxima, and question for Still 2004. You're asking what type of knee injuries athletes get. Most commonly, it's the ligaments in the knees, the ACL. That's a ligament, anterior cruciate ligament. The ACL is a ligament in the knee that gets torn when the knee is bent the wrong way. And other times you get the meniscus. The meniscus is a bit of cartilage in the knee that can get torn when the knee is bent or twisted.
That's good.
Holy Illusionist, you had a question?
Yes, sir. Well, my question is basically about health, as in long life expectancy. For example, my great-grandfather, okay, he died at the age of 105. Okay, he never drank, he never smoked. But now I'm looking back at it, and our family doesn't have any type of disease. Yes, I mean any type of disease. And my great-grandfather was overweight, okay, and he lived a very long life. Now my question is about me, about my health, okay? I've never gotten sick, as in fatal disease or anything like that that'll get me to bed. Nothing ever. But my question is, how long do you think that my life expectancy would be with never touching a cigar, never touching a bottle of alcohol, but not much so active? So not very active, but no drinking and smoking. What do you think about that?
Well, thanks, Holy Illusionist, for your question. It's a pretty good sign that your grandfather lived to 104. There's no guarantee you're going to live to 104, but if you have good genes and both your parents and grandparents have lived to a ripe old age, then there's a good chance you will too. It's good that you don't drink and you don't smoke. Maybe you should try to work out a little bit too, just to shore up your bets a little bit.
Okay, Mark, because, well, my parents, my parents are both very healthy. Never, ever any type of disease, no diabetes, no nothing. Never. And the thing is that I'm not very active. I still am active, but not so much. And the thing is that I have planned for my future, okay, into helping the poor, and I want to have that time just for them and for me to be able to dedicate my life to them. And I'm just looking forward to it, because I don't know how long I'm going to live, but one thing I can tell you for sure is that I am happy all the time. Okay, I feel happy, I feel normal, I feel very healthy, okay? And I'm not the kind of people that get depressed, okay? There's no time for depression or anything like that. But I just wanted to talk to someone that knew about health, because I care about my health. But the only thing is that I'm not very active. And I weigh 190 pounds, okay? Thank you very much for your answer. Thank you very much.
You're welcome, Holy Illusionist. And good luck with your plans to help the poor people. I think that'd be great. We never know how long we're going to live, but hey, you got to make the best wish you have. Question by Sil 2004. So guys, we need some more questions on hands. Anyone out there having a problem with carpal tunnel syndrome? Hey Gary, how are you?
Pretty good. Well, I'm glad that you're here with us. The last caller, I just wanted to comment a little bit on him and see what you have to say about this, doctor. He says he's 190 pounds at 6 feet. I guess that's just slightly disproportionately overweight, but I don't know about around the rest of the world, but we tend to be quite obese here, relatively speaking, in the United States. And there was just a new study that came out, and they said if you did 4 things